going to be testing the neurological system. So first we're going to start with the cranial nerves 1 through 12, and then from there check the deep tendon reflexes. So for starters, cranial nerve number 1 is the olfactory nerve. This is where we're going to test a patient's smell. You can do that by getting incense or some type of scented fragrance or flowers. So we're going to use our lovely prop here that has flowers. Have the patient close one nostril at a time and see if they can smell. If they can, it's intact, and that nerve works. Cranial nerve number 2 is the optic. This is going to be the visual acuity. You can do this by the Tegan'slife chart, or also by having them cover your eye. And then you take it in your hand and let me know when you can see my finger.
Mm-hmm.
Perfect. And then other one, and then same thing.
Yep.
Perfect. So that nerve is intact. Cranial nerves 3, 4, and 6, which is the oculomotor, trochlear, and the abducens is going to test all the eye movement, and then the pupil dilation. So the ocular one is going to, we can do perla. This is just going to let us know if the pupils are equal, round, and reactive. You'll get a light. You'll have them look straight ahead right at you. And that works. Perfect. Bright light. And you can also do the cardinal field as well. Look straight ahead and just follow my finger. Perfect. You want to look for any involuntary movement or nystagmus with that too, making it just being not normal. From here, we can then test cranial nerve number 5, which is going to be the facial expression one, which is the trigeminal. You can ask the patient if they feel sensations on both sides by using a cotton swab, or you can have them raise their eyebrows. Raise your eyebrows for me, please. Okay. And you can. Squint your face. Perfect. That nerve is intact. From here, we can go to cranial nerve number 7, which is your facial nerve. This can be the test and facial expression. I don't have anything for him to test with, but if you taste with, but if you can smile for me, perfect, that's intact. He can smile. Cranial nerve number 8 is going to be the auditory. This is just going to test the patient's hearing. I will stand behind them, cover an ear, and whisper in both ears, and then him respond back.
Cat. Dog.
And he can hear. All right. Cranial nerve number 9, which is the glossopharyngeal, is going to be taste and swallowing as well. This one you give a patient a glass of water or something to eat, see if they can taste it. In this case, people can just voluntarily swallow. So if you could swallow, perfect. You just want to look to see if it goes up and down, and they are able to swallow clearly. Cranial nerve number 10 is the vagus nerve. This is where we're going to have the patient open their mouth, stick their tongue out, and say ah, and you want to make sure you see the uvula rise. Perfect. And that is intact. Cranial nerve number 11 is the accessory nerve. This is where we're going to check to see if the patient can put their head to the right and to the left, and then also shrug their shoulders. So if you could look to your right for me. Perfect. And then to the left. Okay. And then shrug your shoulders. And he can. All right. Cranial nerve number 12 is the hypoglossal. This is where we're going to have the patient stick the tongue out. If you could stick your tongue out for me. Okay, move it to the right, to the left. Perfect. And there's no deviation noted there, so that's good. So that's the end of those cranial nerves. Next, we're going to move on to the deep tendon reflexes. Starting with the brachioradialis. We want to do this on both sides, but we're just going to video on one side. You're going to hold the patient's arm here. You're going to feel for where the bend would be, and you will take a hit, and you should see some movement right here in the wrist, which the thumb moved. Next is going to be the biceps. You will hold the arm, and then you will hit about right here, and you'll see some movement. Next is going to be the triceps. You'll hold the arm out. They will kind of just dangle it as best as they can. Feel for the groove, and then it should move out. Next is going to be the quadriceps or the patellar. You're going to feel for the below the knee. I'm trying to pull below the knee. There we go. It went out. And then next is going to be the Achilles. You will hold the patient's foot out, and then you will hit behind the Achilles. It will have movement. Those, we have a grading scale from 0 to 4. 0 being absent, and plus 1, 2 being normal. That's what we want them to be. And then 4 being hyper-exaggerated, meaning that there could be something wrong. And that is all. Thank you.